Hello everyone, my name is Thomas Otalvaro, I am from Colombia. My EDX username is TomVS21 and my GitHub username is TomVS21. This video will be recorded on October 2, 2025, and today I'll discuss the ransomware attack that occurred at Wayne Memorial Hospital in Georgia from May 30 to June 3, 2024. The attack was discovered on June 3. While there's no specific CVE assigned to this incident, it involves CVE 2021-44228, a common vulnerability known as Logshield, which the Monty ransomware group frequently uses for initial access. I choose this topic because it clearly illustrates how ransomware can cripple healthcare systems, expose sensitive data, and directly impact people. Let's start with context. Wayne Memorial Hospital, a regional healthcare provider located in Jesus, Georgia, serves thousands of patients in a rural area. On May 30, 2024, attackers from Monty ransomware group infiltrated the hospital network. The hospital discovered the breach on June 3, when system failures began. Files were encrypted and ransom notes appeared alongside ransom requests. Active since 2022, Monty is a ransomware as a service group that reuses code from existing threats like County. Monty has reclaimed responsibility for more than 16 attacks targeting sectors such as healthcare and government agencies. In this incident, Wayne Memorial Hospital was listed on a dark web data breach site, but some people confused it with another hospital of the same name in Pennsylvania. The damage was devastating. Data including 163,440 patient names, dates of birth, social security numbers, driver license numbers, user login information, credit information, healthcare insurance, diagnoses, treatments, medical histories, test results, and even prescriptions were compromised. This medical information is protected by the Health Insurance Portability and Accountability Act, HIPAA. Imagine the risk of identified theft and healthcare fraud. Hospitals were forced to shut down their systems, patients' care was interrupted, and attackers attempted to extort money, but no attacks have been detected yet. Now, let's look at the technical details. Ransomware like Monty follows a typical attack pattern, which directly relates to the malware and ransomware topics covered in this lecture. First, let's look at the initial approach. Monty frequently exploits unpackaged software vulnerabilities. Many attacks, including this one, exploit vulnerabilities in the Apache Loggage library, such as Logshield, CVE 2021-44228, which allows remote code execution. Healthcare systems are often targets of attacks due to their use of legal software like VMware, Horizon, and outdated network tools. Attackers likely establish a foothold by scanning for exposed services and injecting malware once inside the network. They move throughout it using a stolen credential or poor internal controls. These exploited vulnerabilities in data as a res encryption, a key topic of the lecture, because data was not properly encrypted on servers. Monty used tools like Acrium 1 to remotely monitor at, and map the sanctuary network. Ransomware then scanned files and encrypted them with a strong algorithm like AES-256, rendering the data inaccessible. There, they exploited vulnerabilities in data at rest encryption to attack the database where patient records were stored. Finally, they posted a ransom note, apparently in the form of a text file, demanding payment in cryptocurrency via Tor. This entire process took only a few days, and the introductory module highlighted the zero-day risk. While there is no specific CVE for Wayne Memorial, vulnerability categories like NEST and MVD indicate that Lockshot affected thousands of systems, highlighting the importance of patching. Here's a summary of Monty's main tactics and how they connect to our course topics. Exploit virus, lateral movement, encryptions, something like this. The hospital response was swift but reactive. On discovery, they disconnected the network and took system offline standard playbook from the ransomware section. They restored from backups, which worked because they had offline copies, avoiding payment. They also reset all passwords network-wide, tying into the password module, and hide it. Cybersecurity pros for forensics to support patients. They're offering 12 months of free credit monitoring, but this reactive approach shows the cost. Downtime in healthcare can be life-threatening. Finally, recommendations to avoid this outcome, drawing straight from the course to help organizations like hospitals. First, proactive vulnerability management. Regularly scan and patch using tools like Nessus. Focus on catalogs from the introduction module. For multi-like threats, prioritize CVS like Lockshot, Pros, stops attack early, counts, requires and schedule and maintenance, but it's a trade-off for security. Second, strength data protection. Implement data at rest encryption for all patient databases. Use AES or public key encryption from the data security module. Use this in conjunction with the 3-to-1 backup rule, which means storing 3 copies of 2 media types, one of which is offline and immutable. This prevents Wayne Memorial from having to pay a ransom. Also, as described in the introduction, deploy antivirus and EDR tools to detect malware early. Third, strengthen authentication, implement multi-factor authentication and password manager for all employee logins, as outlined in the password module. A hospital-like reset policy is good, but enforce it regularly. For more comprehensive privacy, use a VPN or SSH to prevent man-in-the-middle attacks via remote access. These steps balance usability and security, prevent cryptographic disasters.